Hi, my name is Stacy Swiczek. I'm out of the St. Cloud campus, and in the structure and function class, we were to choose a pathology of choice. My pathology was fibromyalgia. This is something that I think goes underdiagnosed way too often and hopefully can be easily diagnosed in the future. Okay, so let's talk about fibromyalgia a little bit. This is a very complex condition that is difficult to understand. It's especially difficult if you don't have any medical background or degree. It does involve the brain and the nervous system and can have an impact on virtually every part of the body, ranging in very different levels of pain, from some little pain to a whole lot of pain that's almost unbearable. Fibromyalgia has many possible causes. It could be from a genetic predisposition, a prolonged or excessive stress that has been in your life, a triggering event such as an accident, a viral infection, or a traumatic event. It's really hard to pinpoint what exactly it could be until they are able to put some sort of finger on what actually causes the problem. I think this is going to continue to be a very hard diagnosis to come by. Some of the symptoms that are caused by fibromyalgia really can range from different ends of the spectrum. It can really have a lot to do with what's going on in your brain to what can be going on just in your body in general. Even though the list may be long, some of the symptoms for fibromyalgia is persistent pain in the muscles and ligaments. You can have an unrefreshing sleep or poor sleep. You may be fatigued, mild or totally drained, cognitive and memory impairments, recurrent headaches, morning stiffness, irritable bowel syndrome, environmental sensitivity, irritable bladder, numbness and tingling sensation, muscle spasms and or twitching, dizziness, impaired coordination, chest pain, intolerance to heat or cold, also intolerance to skin touch, frequent abdominal pain, breathlessness, frequent eye prescription changes, dry eyes and mouth, skin rashes, sinus and allergies, and you are subject to swelling and mood swing disorders. These are just a few of the symptoms that I can list. There are many more that can go along with this, which is why this is so hard to pinpoint as a final diagnosis. So fibromyalgia is going to be affecting the cells in your body. It's going to affect your muscle cells, which has many layers that it goes through to cause the pain, and usually will end up in the ligaments. So it also affects the connective tissue cells, which is the tendons, the ligaments, the fascia. It really has a deep layer of pain area. It can go from one end to the other realistically. It can really affect your body, meaning from very little pain to totally intolerable pain, and make you feel disabled at times. The nerve cells that are affected are called Schwann cells. There are so many of them, and they have that neuron and the myelin sheath and all that stuff. The neuron is what sends off the pain signals. And here we are talking about the organs that are affected by fibromyalgia. There is a large list of them when you think about the big picture. Your muscles, your tendons, your ligaments, your skin, your brain, your stomach, your bladder. This has a lot of area covered in your body when you are in this much pain. Like I said, the diagnosis for this is a very hard one to be made. First of all, you have to have pain for at least 3 months on the left and right, anterior and posterior, and above and below the axial line. You have to have pain at 11 or more of the tender points, which include the base of the skull, neck and shoulder, upper and inner shoulders, upper and outer buttocks, hip bones, just above the knee on the inside, below side bone at the elbow, edge of the upper breast, and lower in front neck. And the lower neck in the front. All these places have to be affected in order for this diagnosis to take place. I know that depression and anxiety also go along with this, which is usually the start of the diagnosis. Okay, so I know I said before that anxiety and depression are one of the top things in fibromyalgia or diagnosing fibromyalgia. The typical progression to the diagnosis of fibromyalgia, you have to have an active ligament injury or causing pain. The diagnosis of tendonitis would be made. You would be ordered to have an MRI. They would then diagnose a disc problem and then refer you to a pain clinic. The diagnosis of depression would be made by then, and if there's no response to any of the medical interventions at that point, the diagnosis of fibromyalgia will come up. Like I said, this is just a typical progression to the diagnosis of fibromyalgia. There also needs to be a lot more work and details and all kinds of different things figured out from that point on, and more research for sure. But there are so many out there that are suffering, and there's no diagnosis or anything to help them at this point, or a quick diagnosis to help them at this point. So the treatment of fibromyalgia, wouldn't it be awesome if there was just a quick fix for this? However, there is no long-term treatment. The best way to handle the diagnosis of fibromyalgia is educating yourself. Education is so important in any sort of medical diagnosis, especially one that isn't well known of at this point. Management of pain, whether it be over-the-counter pain medication, prescription medication, counseling, anything that's going to help you release that tension and anxiety. Establishing a healthy pattern of sleep. Sleep is so important for your body to be able to heal itself and let those cells and organs get rest to heal themselves. Diet and exercise is a huge part of this. Being able to keep those ligaments and joints and bones all limber and basically lubricated to be able to want to move at an easier level, or moving easier in general. The reduction of stress. Stress can actually make this flare up at times and make it worse for anybody. So being able to cut out some of the stress in your everyday life would be a huge help with that. You may have medications that could help out with that a little bit with the anxiety, but those things there in its own won't fix the problem permanently, but can definitely relieve some of the pain and anxiety you may have over it. So here's where I would like there to be more research and find more prognoses for the fibromyalgia diagnosis. It has no definitive cure at this point, and living with fibromyalgia and learning to function with it, managing its triggers, exercising, healthy diet, this is all a full-time job basically, but it's what is needed to be done to stay comfortable and keeping up with your everyday life. Fibromyalgia may remit, and reoccur. So it may get better and it may not. Is kind of the downfall to that. It may have times where it's very minimal, and it may have times that it's flaring all the time. You may go many years without having any sort of flare-up, I guess I would call it. But that, for now, is kind of the prognosis of fibromyalgia and how to cope with that. Hopefully you've enjoyed this. This is kind of my passion right now of trying to figure out what causes this, what can make it better, what can I do to make the difference. Fibromyalgia is very underlooked and very hard to diagnose, and I just feel that there are people out there that could have a better quality of life if the proper diagnosis were made. And so that is my pathology report, I thank you for taking the time to listen to it. I will continue to do research on it, as it is something I would like to learn more about. Thank you for all your time, and I hope you have a great holiday. Thank you.